Welcome back to my channel. In this video, we are going to see about sacral plexus. The formation of sacral plexus by the ventral rami of L4, L5, S1, S2, S3 and S4. In this, the L4 nerve root, which is already involved in the formation of lumbar plexus, and it is also involved in the sacral plexus too. Hence, the L4 nerve root is called nervus furcalis. Here we can see the formation of the nerve roots L4, L5, S1, S2, S3 and S4. Ventral rami of L4, L5, S1, S2, S3 and S4. Here in this the sacral nerve roots which are arising from the sacral foramina, which lies here, it is arising from the sacral foramina, and this crosses the anterior surface of the sacrum. While crossing this, it lies in front of the piriformis muscle. This is piriformis muscle. This one is piriformis muscle. It crosses in front of the piriformis muscle. Above that, the formation of the lumbosacral trunk can be seen. The L4, L5 nerve roots join to give the lumbosacral trunk, which going to join with the S1 nerve root and the succession nerve roots of S2, S3 and S4. These nerve roots, the sacral nerve roots, which are receiving the gray ramus communicants from the corresponding sympathetic ganglion. So it receives the gray ramus communicants through the sympathetic ganglion. And the passage here between the lumbosacral trunk and the S1 nerve root, the passage of superior gluteal artery is occurred. And between the S1 and S2 nerve root, passage of the inferior gluteal artery occurs. And these are the two terminal branches, that is the sciatic nerve and the pudendal nerve. That is the two terminal branches of the sacral plexus. Between these two, passage of the internal pudendal artery occurs. So before going to form the sacral plexus, each nerve has to be divided as ventral and dorsal division. Now, branches of sacral plexus. Totally 12 branches are arising from the sacral plexus. 5 set of nerves are mainly supplies to the pelvic surface, which are nerve to piriformis, pelvic splanchnic nerve, nerve to levator ani and coccygeus, pudendal nerve, and perineal branch from S4. This 5 set of nerves mainly supplies to the pelvic region. And then 2 terminal branches, sciatic nerve and pudendal nerve are the 2 terminal branches. The remaining 7 set of nerves are supplies to the gluteal region and lower limb. Totally 12 nerves are arising from the sacral plexus. 5 nerves are mainly supplies to the pelvic surface. 7 nerves which are supplies to the gluteal region and lower limb. Now in this, first we'll see the nerves which are arising from the roots. 3 set of nerves which are arising from the roots, which are nerve to piriformis, nerve to levator ani and coccygeus, and pelvic splanchnic nerve. These 3 nerves arising from the root of the sacral plexus. Then the remaining nerve which are crossing the greater sciatic foramen. While crossing the greater sciatic foramen, at the upper border of the piriformis, superior gluteal nerve arising. At the level of the lower border of the piriformis muscle, the remaining nerves are arising. The remaining 6 nerves are arising. Order from lateral to medial is, first one is the sciatic nerve, then posterior femoral cutaneous nerve, nerve to quadratus femoris, inferior gluteal nerve, nerve to obturator internus, and pudendal nerve. In this, the nerve to obturator internus and pudendal nerve are the one which crosses the greater sciatic foramen, then it crosses the dorsal aspect of the ischial spine. It is then enter into the lesser sciatic foramen by piercing this, entering into the perineum. So crossing the lesser sciatic foramen enters into the perineum. So now the roots that is giving a branch are nerve to piriformis, pelvic splanchnic nerve, nerve to levator ani and coccygeus. The nerve from S1, S2 join to give nerve to piriformis, which is supplies to the piriformis muscle. And the nerve which are arising from S3 and S4 joins to give nerve to levator ani and coccygeus. This going to supply the sphincter ani externus and the surrounding part of the adjoining part of the skin. The next nerve which is arising from the root is pelvic splanchnic, which is arising from S2, S3 and S4 joints to give pelvic splanchnic nerve. This carries the preganglionic parasympathetic fibers and viscerosensory fibers. Each nerve of this going to form a plexus, that is inferior hypogastric plexus. This lies on either side of the rectum, which mainly supplies to the pelvic surface a few part of the fibers which ascend upwards and supplies to the left colic, descending colon and sigmoid colon. The parasympathetic fibers of this that is the motor fiber of this produces secretomotor to the glands, giving a peristaltic action and gives an inhibitory action to the sphincter ani internus. And this parasympathetic supply in the urinary bladder, it acts as it causes contraction of the urinary bladder and relaxation of the sphincter occurs. And it is on the uterus, it produces relaxation of the myometrium muscle, that is inhibit the contraction of the myometrium of uterus. This nerve, it is also called a nervi erigens. Why? Because it causes ejection of the penis, erection of the penis, produces erection of the penis. That is why it is called a nervi erigens. Whereas the ejaculation of the penis is completed by the sympathetic. So this is the nerves which are giving out from the root of the sacral plexus. Next, branch from the ventral division. Ventral branch of ventral rami of L4, L5 and S1 joins to give nerve to quadratus femoris. So this nerve to quadratus femoris, it is going to supply the inferior gemellus and the quadratus femoris muscle, and it is giving a tweak to the hip joint. The next ventral branch of ventral rami of L5, S1, S2 joins to give nerve to obturator internus. Nerve to obturator internus comes out through the greater sciatic foramen, crosses the dorsal aspect of the ischial spine, enter into the lesser sciatic. Before entering into the lesser sciatic foramen, it is going to supply the superior gemellus and supplies to the obturator internus muscle. The next branch, ventral branch of ventral rami of S2, S3 and S4 joins to give pudendal nerve. So pudendal nerve is the one, it is one of the terminal branch of the sacral plexus. It is going to supply this nerve comes out through the greater sciatic foramen and then enters into the dorsal aspect of the ischial spine, then enters into the lesser sciatic foramen. Here it lies medial to the internal pudendal artery and nerve to obturator internus. It is then enter into the ischiorectal fossa through the lesser sciatic foramen, In the pudendal canal, it lies along the pudendal canal. It is accompanied with the internal pudendal artery and it gives off branch such as inferior rectal nerve, perineal nerve and dorsal nerve of the penis. Here the perineal branch of the nerve, it is giving a superficial and deep branch. Deep branch is going to supply the muscles of superficial and deep perineal pouch. And the superficial nerve becomes one of the sensory part. Now the dorsal branches arising from the sacral plexus. So dorsal branches, so this is a ventral division here. This one is a ventral division and this is dorsal division. From the dorsal branch of ventral rami of L4, L5 and S1, L4, L5 and S1 give rise to superior gluteal nerve. This superior gluteal nerve arising at the upper border of the piriformis muscle and it is going to supply the gluteus medius, gluteus minimus and tensor fasciata. The next branches which are arising from the nerve root of dorsal branch of ventral rami of L5, S1 and S2. Dorsal branch of L5, S1 and S2 gives inferior gluteal nerve. This nerve arising comes out through the comes out below the that is inferior border of the piriformis muscle and it is going to supply the gluteus maximus muscle. Next, dorsal branch from S2, dorsal branch of ventral rami of S2 and S3 give rise to perforating nerve. That is perforating cutaneous nerve. This nerve which pierces the sacrotuberous ligament to supply the skin of the lower part of the buttock. Then the next branch which has both dorsal branch and ventral branch of ventral rami. These two components join and gives a nerve that is sciatic nerve. That we'll see how. That is ventral branch of ventral rami of L4, L5, S1, S2, S3 joins to give tibial component of sciatic nerve. And dorsal branch of ventral rami of L4, L5, S1 and S2 joins to give common peroneal component. The tibial component and common peroneal component together we can say it as sciatic nerve. So sciatic nerve contains both the components. This comes out through the greater sciatic foramen and the main branch which is supplying from the sciatic nerve or hamstring muscle. It supplies to the hamstring muscle. It means it supplies to the semitendinosus, semimembranosus and biceps femoris. And the sciatic nerve is one of the terminal branch of the sacral plexus. The next nerve that is next to this sciatic nerve is posterior femoral cutaneous nerve. So medial to that sciatic nerve is posterior femoral cutaneous nerve. This also having both dorsal and ventral branch. Ventral branch of ventral rami of S2 and S3 and dorsal branch of ventral rami of S1 and S2 give rise to these two components join give rise to posterior femoral cutaneous nerve. This nerve is going to supply the skin of the back of the thigh, back of the gluteal region and it is going to supply back of the leg up to the middle part of the leg is supplied by the posterior femoral cutaneous nerve. So these are the branches, that is, these are the branches which are having both the dorsal and ventral branch of ventral rami. So now all the formation, branches, relation, everything has been told about in this video. If you like this video, please share and subscribe. Please click the bell icon.